I have these remarks from my board chair, my able board chair, that's retired General Dr. Karangi. On behalf of Principal Secretary Timothy Gabriel, NCPD Director General Dr. Mohammed Sheikh, all our board members, UNFPA country representative and us, our esteemed partners drawn from government, development, and implementing organizations, distinguished guests, ladies and gentlemen. I wish to welcome you all for honoring our invitation as we launch the State of the Kenya Population and State of the World Population Report 2023. NCPD is a semi-autonomous state agency whose main role is to coordinate the implementation of the population policy and program in the country both at national and county level. The Council, therefore, is the focal point on all matters relating to population and development issues in Kenya. The Council was established in 1982 as a department under the then Office of the Vice President and the Ministry of Home Affairs, and later re-established as a semi-autonomous government agency known as SAGA under the National Treasury and Economic Planning 2004. It is a mandate with various functions, among them to identify and advise on population issues that may not be adequately or appropriately dealt with by the government. In implementing this function, the Council prepares annual status of Kenyan population reports, whose theme is guided by the State of the World Population Report, which is produced by UNFPA. The preparation of this year's report was funded by the government of Kenya, and we want to thank them for this. Distinguished ladies and gentlemen, the Council appreciates the excellent work that was done by the technical officers drawn from the 3 divisions of the Council. I wish to also appreciate our partners, particularly the African Population and Health Research Center, African Institute for Development Policy, and UNFPA for their technical input towards development of this report. This report highlights key areas of population concerns that require actions in order to accelerate the achievement of our development aspirations. In conclusion, the Council will continue to identify and advise on population issues that are not adequately or appropriately dealt with by government through the publication of subsequent state of population reports. I want to thank you, and let's make sure we understand the state. Thank you so much.
Thank you, Director Bafin Sigei, on behalf of our chair. So, ladies and gentlemen, right now we are at this juncture where we are going to have remarks from our Principal Secretary, the representative of Principal Secretary, Mr. Timothy Gabriel. But before that, I want you to stand, because for our peers we always stand up, our CS will stand up. Government protocol, so to be a coffee, I can't. He is also our EPS, our Economic Planning Secretary. So, EPS and Representative of PS, please welcome and make the remarks. And after that, we're going to launch the documents. Karibu, please. Thank you.
You know, it's a moment like this that you enjoy yourselves. Good morning.
Good morning.
Good morning.
Good morning.
It's very interesting. Actually, I was more or less among the first to arrive, and I was in this room. I found the team setting. Little did I know I was a guest. And actually reminded me way back in 2008, where I was the pioneer chief executive of CDF in Kenya. And then we were launching a school in my neighborhood. And the famous Waitito was this kind of MP then for Embakasi. When it was mobilized everybody to really receive the guests, little did they know that I was just among the neighborhood. And I just walked to the podium and I'm the guest. Ladies and gentlemen, my name is Timothy Gabriel. the acting economic planning secretary, but this morning I'm here on delegated responsibility by the principal secretary, James Muhati. As the DG explained that obviously would not have been here because he held up in another official responsibility in Mombasa. Now, before I read the speech by the PS, because protocol demands, the moment you read the speech, you don't add anything else. Otherwise, you'll suffer the consequences. Let me just say one or two things, because I realize in this room, there are faces that are familiar. One of the greatest guys that I saw in this room was Mr. Muhati. Muhati and myself shared a room at the Queens, that is in US, for some little bit of 5 days or so. So I know Muhati in and out. He told me that one day I'll come back and I'll be his boss. So I'm so happy to do that. Now, ladies and gentlemen, let me look at you and friends. When you look at me, how would you describe me? How would you describe me? There, I can see you're smiling. Honestly, my looks, I've had issues with my looks. I'll explain in a while what issues. Allow me, and I think you're indulgent that I share a joke, or rather what I would consider as such. Someone who I would rather categorize is actually rather a very naughty young brother of mine. But a good friend, I would just tell you, because right now I'm actually the elder in the family, having lost two of my senior brothers between actually last year and this year. So I'm actually the eldest. So in a family gathering last month, he joked that were there to be an emergency call in my neighborhood to 991 related to a pregnant mother who really needed to be rushed to hospital. And an emergency ambulance responding spotted me walking around for a regular to pounce on me with the mistaken belief I was the patient. Ladies and gentlemen, that was not a very good joke. But as I say, this is a very good friend of mine, a very good brother. What am I alluding to? There is a suspect out there that there are more people out there with unique tummies than pregnant women. I believe the report today settles this conjecture. Our colleagues and partners, in my public discourse, I've actually been all over. I privileged myself, I was a pioneer director who pioneered what's called the National Youth Council in Kenya, and I think it's because of that capacity I was able to attend a forum related to issues about populations in New York. I've been in many ministries. I've worked in what's called the districts, what used to be called the DDO, district government officers, what used to be called the provincial planning officers. And I've had the privilege in this country to be part of the team that crafted the Kenya Vision 2030. Most of you may not know actually how we did it. We used to have the leader then, who would be actually the late governor of Nyeri, Dr. Kaku, used to be basically our leader. We crafted together with everyone in Kenya the Vision 2030. She was part of that team. And I'm privileged also to serve in my current capacity as the acting economic planning secretary, courtesy of the PS James Muhati, and obviously Professor Dongo, who is basically the current the cabinet secretary, National Treasury and Economic Planning. Of course, as you are aware now, we are gearing ourselves through obviously the executive guidance to launch what's called MT4. I believe actually the report that we are launching today will be very key evidence to support the interventions that are actually provisioned within what we call the bottom-up economic transformation agenda. And obviously the issues about the interventions, the issues about the employment, I can tell you they are highly integrated in that document that we are about to launch. Then allow me then, as I said, I'm here on delegated responsibility to read the official speech of the Principal Secretary for State Department for Economic Planning during this launch as delegated. the Director General, National Council for Population Development, my friend and colleague, DG, Kenya National Bureau of Statistics, who I've known actually for many years at the Our House, Ministry of Energy, Thomas Anderson, the country representative, UNFPA, who I know very soon will be sponsoring me for a trip to US. Ladies and gentlemen, all protocols observed, good morning.
Good morning.
Good morning. It is a great honor and privilege for me to join you today to launch the annual State of Kenya, a State of World Population Report 2023. I would like to take this opportunity, this is the PS speaking, the PS speaking. I would like to take this opportunity to express my gratitude to UNFPA for supporting these events, and many of you, as well for the support of the implementation of the national population programs since 1974. In addition, I wish to thank the National Council for Population and Development, through of course the DG and the chair, for organizing this kind of event. Of course the food, the breakfast was fantastic. That has brought us together to share global, national, contemporary population issues and trends which will inform our development agenda to the year 2030 and beyond. And of course, what we are basically calling out the Agenda 2063. The Agenda 2063, where obviously Kenya is on course in terms of implementation. The theme of the State of World Populations, as has been amplified by the earlier speakers, is 8 billion lives, infinite possibilities, the case for rights and choices. The theme was coined at the time when the world population had reached 8 billion people. This theme was domesticated, and the theme of the State of Kenya Population Report is population anxiety. These two reports, ladies and gentlemen, provide highlights of the current and emerging population issues that require policy and program actions at global, national, and subnational levels in order to accelerate achievements of our development aspirations. The what we call the devolved system of government today. Of course, you know we are for 7 county government and of course the one national government. Ladies and gentlemen, on matters population size, growth, and structure, you agree with me, Kenya has made a tremendous progress in reducing her rapid population growth. That was identified by session paper number 10 of 1965 on African socialism and its application to planning in Kenya as an impediment on the realization of the national development aspirations that we set ourselves immediately after independence. Since 2009, Kenya registered improvement in demographic indicators, with population size increasing almost 1 million people per year, from 37.7 million in 2009 to 47.6 million in 2019. The intersexual population growth rate declined from 2.9% per annum, I remember it was mentioned earlier, between 1989 and 2009 to what the DG is saying, because basically you generate the figures, to 2.3% between 2009 and 2019. And this population growth rate, Kenya population is projected to reach 57.8 million by the year 2030. I really wish this obviously will also be supported by those from Mount Kenya, where obviously I don't know the fertility now it is. The population of children below age 15 years declined from 30% in 2009 to 39% of the population in 2019. Youth in Kenya constitute about 29% of the total population. Markedly, the youth population grew from 3 million in 1989 to around 13 million in 2019, and is projected to increase to 18 million by 2035. This youth batch presents the country with great economic and social opportunities, but also enormous challenges that are causing general anxiety. The proposed population is the working ages 50 to 64 years increased from 53 in 2009 to 57 in 2019%, while the population of the elderly aged 60 and above increased from 5 to 5.8%, representing an increase of 1,943,000 in 2009 to 2,740,000 in 2019 for the total population. The older persons are the fastest growing population segment in the country as a result of the improvement in the life expectancy that has increased among men from 58 years in 2009 to 61 years in 2019, and for women from 62 years in 2009 to 67 years in 2019. So you can see men obviously now, there's a likelihood will survive beyond 61 years. Yes. Of course, I know our ladies keep on saying that we may not be able to get there, but we'll be able to manage. The segment of the population, the older persons, require social support in terms of cash transfer and medical care in order to protect them from shocks, reduce the use of negative coping strategies that undermine long-term livelihood sustainability, and allow them to live longer. On education and training, ladies and gentlemen, you agree with me that Kenya has made tremendous progress in the promotion of transition from education to employment of our young people, which constitutes a fundamental step in laying a foundation for future earnings. The completion rate for basic education was recorded at 85.6% in 2022, while the total enrollment in both public and private universities increased to 568,000 in financial year 2019 to 620,000 in financial year 2021-2022, representing a 9% growth during the period. The number of trainees enrolled in technical and vocational education training, what we call TVET, and special needs educations close to the heart of the HE in this country increased from 2,414 in 2019-2020 financial year to 3,805 financial years 2021-2022. The Constitution of Kenya obligates the government to take measures, including affirmative action plans, to ensure that the youth access relevant education training. The country has various policy responses, including making skills training and entrepreneurship development one of the priority areas in the National Youth and Development Policy. Kenya's investment in health, education, economic and governance sectors offers an excellent opportunity for the country to harness the potential of the young people in order to accelerate socio-economic development and developing of the system in the next coming decades. The realization of the democratic dividend, and Muhati, I want to really echo you. You assisted me to understand what is this we call dividend, democratic dividend. I was still struggling to understand what it is, but at least to the courtesy of Muhati, I was able to understand. The realization of the democratic dividend in Kenya, as envisaged the Kenya Democratic Dividend Roadmap 2020-2030, will depend on how fast we shall create jobs for employ youth and turn the youth into a blessings. If I was talk about the youth in Kenya, because I championed the youth agenda in this country, I'm telling you, most of you go home, they're very irritated. The system and the youth were used to give, they used to express about what they would call their parents. One called it spoiled, the lost parenthood. That's what they were calling lost parenthood. We do not actually care how we feel, how we think. If I had the time, obviously I know within the ministry now I'll get that opportunity to talk about more that. Between 20 and November 2022, Kenya recorded 340,431 positive cases of COVID and 5,610 deaths in 2021 of the 3,138 children aged between 0 to 4 who died of age-related illnesses. 60% were children below 5 years of age. Kenya mortality and cost of death report 2021 showed that the leading cancer-related deaths were esophagus cancer at 16%, cervix cancer at 10%, breast cancer at 10%, and liver cancer at 9%. National Safety and Transport Authority data shows that the number of people involved in accident has increased from 11,215 in 2017 to 21,760 people in 2022. Although mortality has been on the decline, the country has recorded increasing deaths resulting from non-communicable diseases, accidents, and injuries. Allow me, ladies and gentlemen, to talk about migration and urbanization. Though I know, obviously, I as speaker is agreed to, but this is what basically the peers is saying. There has been increasing concerns at the global and national level due to the opportunities and challenges it presents to individuals, their families, and the countries in general. Although Kenya has been experiencing critical international migrations, there is a sizable population of refugees, which together with internal migrations, fertility and mortality have served as key drivers of population change. Migration, fertility, and mortality have influenced the population structure, size, and composition in Kenya. Rapid increase in urban populations has been witnessed since independence, and this has largely been driven by natural increases, the difference between birth and deaths with urban populations and the rapid rural to urban migration. Kenya is urbanizing very rapidly, with the percentage of urban population, the total populations have increased from 5.3% in 1948 to 31.2%, representing 14.8 million people in 2019. In addition, the number of urban centers increased from 47 in 1969 to 372 in 2019. Of our four cities, Nairobi, Kisumu, Mombasa, and Nakuru, the urban centers are struggling to provide infrastructure and urban environment for innovation. Due to rapid urbanization, this has led to the emergence of informal settlements, where 1 million people were eliminated during the 2019 population housing census. The populations living in informal settlements experience many challenges, including abject poverty, inadequate access to basic social services, lack of stable livelihoods, and high unemployment rates, majority of whom are basically youth. Migration is regarded as a stressful process as it involves the loss of social support from the community and family members. This process is associated with stress, growth, and social marginalizations, often leading to anxiety and depressions. It causes disruptions of family life, and therefore loss of social support, expectations by the relative to set limitances, and acculturations quite often leads to anxiety among the immigrants as they adapt to the new social environment and lifestyle. The population placer in densely settled areas has resulted in immigration in less densely populated areas, where people from different communities have both run from the local inhabitants. This poses a risk of endemic tensions and conflicts in these areas. Rapid rural-urban migrations, ladies and gentlemen, currently witnessed in Kenya, has led to an increasing number of people who are homeless and living in squalor, high crime rate, mushroom of formal settlements, overcrowding, poor housing conditions, poor sanitation, poverty, child malnutrition, other social ills in urban areas. Ladies and gentlemen, as I proceed, I keep on reminding myself the so-called, the late Morogo was PS, youth. Some of us do not understand why this program was coined, the Kasi kwa Vijana. I don't know whether I can remember. Of course, they were saying